Hi, my name is Michelle Hillman. I'm a medical lab technician. I've been a medical lab technician for approximately 24 years. I work in a small hospital in a rural area. I became interested in the medical lab technician field when I was approximately about 10 years old. I was having a surgery done and I had some blood work drawn, and I was kind of interested in what happened to the blood work and how did they get results and how did the instrumentation come up with the results for the doctor. So I started, it was kind of a little thing in the back of my mind, and as I got older, I just kind of reappeared and I started to look into the actual field of medical lab technician. As I got into high school and I started to consider going into the science field or healthcare field, I started to take classes a lot along the lines of sciences and biologies. I took an anatomy and physiology class when I was approximately a junior, and that's probably really where I really got interested in the medical field. I excelled at it and I excelled in my science classes, so I started to look into what different types of medical lab programs were in my area. I attended college at Columbus State in Columbus, Ohio. It was a 2-year degree. I have an associate's degree in applied science, and I took a certification exam to become a medical lab technician. I started working in the field actually when I was approximately 20 years old. I worked in a large hospital in a large city, approximately about 2 hours away from my hometown. I worked in a stat lab where we handled a lot of traumas, and we handled a lot of blood bank urgencies, people that were in car accidents and major traumas. I learned a lot in that 2.5, 3-year experience. I decided to move home. I met a hometown boy, decided I wanted to get married, so I started to look back into the area where I lived. It's one of the advantages to the healthcare field that I'm in is there are hospitals and facilities everywhere that you can transfer to another position. So I started looking at coming back home, and I found a job at a smaller rural hospital. I've been working here for around 22 years, and I started working third shift here. I was lucky. I only worked about a year third shift. I took on a first shift position shortly after we got married, and I was full-time for about probably 8 years, and I've been part-time ever since. So it's been a real advantage with having kids. I have 4 kids, and I am able to be part-time. I still make a really good financial salary, and I can contribute to my husband and I's income, but I have the advantage of working at home, being at home with my kids more. So that's one of the great things I love about the field that I've been in and the choices that I've made. A typical day in a lab is a lot of multitasking, handling multiple situations at one time. If you're really, really good at multitasking, or you like to be busy, and that's a good thing. I wouldn't want to be in an office where I sat around and pushed papers and sat and waited for the phone to ring. In the lab, it's always busy, and that's a good thing. I like it. It makes my days go quicker. A typical day would be for a lab technician. We do handle some phone calls. We handle maintenance on analyzers. We handle, obviously, patient specimens. In our small rural town, I work in multiple departments, so 2 or 3 of us, 3 of our techs might be overlapping each other and helping each other, and one person starts something, another person finishes. So it's really about communication. It's really a plus if you have good communication skills. It's the kind of field that you are definitely hands-on, and we handle pretty much anything that comes out of a person's body. We test it for different types of diseases and diagnoses. One of the statistics I always heard that always made me feel like it was an important thing I do is that like 75 or 80% of the diagnoses that happen to a patient, like when a person comes in sick, 75 to 80% of those diagnoses come from a lab test. I always felt like that was a really important thing. I feel like I'm really contributing to helping patients get better. This is definitely a field where, if you just don't know if you want direct patient care contact, this is an area where we do handle patients, but we're not maybe on the front lines. We're in the back. We're the quiet people that are in the back helping to diagnose patients, and I think that's really makes me feel like I'm a contributor to the healthcare of America. One of the things that I would want to tell someone who's interested or thinking about looking into the medical lab technician field is that it's definitely a field that is ever changing, and there's a lot of technology and things like that, that it's not one of those jobs you're going to go in and do the same thing every day. You're not going to do the same thing in a year. You know, it's ever changing. I think it keeps you on your toes, it keeps you educated, and it keeps you on the front lines of the changes that are going on in healthcare. If I could go back to when I was high school, I at one point looked at nursing, and I had some people try to push me that way and some other ways, and I'm really glad that I did decide to go into medical lab technician. It's been a great field for me. I think that it brings out the best in me and my best qualities. I sometimes, think about, do you want to go on and have more education or, things like that. But for me, it was a perfect combination. I was able to, go get a 2-year degree and have the success of working in the city and then come back and live in a small town. And for me, it's been a great choice. And I think if you're interested in those types of things, this would be a good choice for you.
My name is Lee Kellemeyer, and I am a phlebotomist, medical assistant. I work at Joint Township New Vision Medical Laboratories. I've been here for 8.5, almost 9 years. I didn't start out right after high school pursuing this career. I worked in, at 16 I started working. I worked fast food, and then I went to a nursing home, and then I went to factory work. After that, I met my husband, got married, worked at retail. That was when I realized that retail wasn't work for me, so I decided it was time to go back to school. I was pregnant with my second child at the time, and I decided to pursue medical assisting. And I went to Vantage Career Center and took adult classes. It was about a 10-month course, and in that it gave me a lot that I could actually pursue. I could go into coding, I could do transcriptioning, phlebotomy, EKGs, I could work in a doctor's office front or back. When it came time for clinicals, that's when I chose to come to this hospital and work in the lab. And a former employee that worked in the lab was also one of my teachers at the Career Center, and he told me about coming to the lab. So I decided to do my clinicals here, and I believe it was about 120 hours that I had to put in for clinicals, and then that's when I really realized that phlebotomy was where I needed to be. I enjoyed everything I did. I felt I was good at it. So after my clinicals, that's when I turned in my application, my thank you letter for them allowing me to come. Ended up getting the job about 6 weeks later after I had my second child, actually. So it worked out pretty well. Been here ever since. I was able to work my way up. I mean, there's a lot of room to grow here. I mean, I've also, I could have the opportunity to further my career by going to medical technologist if I wanted to. However, that's not for me. I don't want to know what they do. But in phlebotomy, there's so many aspects of that job that you can do. You can work in an outpatient setting. You could travel and go to places, people's homes, and draw and deliver that blood back to a lab to be processed. I've also been able to learn clerical work, do the lab clerk that we have here. Basically, we process the orders, we fax the results, we take the phone calls, just a lot in that too that you do, besides going out and drawing the blood from ER patients to inpatients to outpatients. I've also been able to go into the pathology department, and I was able to learn the path secretary part, which the pathology, histology, that all deals with a lot of body parts that we receive from surgeries to doctor's offices that have removed specimens from patients. So I've got to see that part of it, and basically the clerical work is more of your computer. You're going to be on that computer more, you're going to be entering information on patients to send those specimens out. I did, however, get to experience the medical assistant side for a short time. I did leave here for about 3 months, and I experienced that. Figured out that was not a fit for me, and was very lucky to come back to the lab, which I know is my home now. I always say that this is my cake job. You know, I found my fit, what I love to do. It has its days. You can go from nothing to traumas to stroke alerts to a full outpatient waiting room. So it's always challenging. It's always something different. It's never going to be the same every day. We're that front line. The patients see us, so we're the face of the lab. So when we're with our patients, if it's outpatients or inpatients or ER, that's who they associate the lab with. So, you know, we're always giving that good patient care. You know, we're answering any questions that we can. We're not doctors, but we get a lot of those questions, but we just refer those patients to, you know, ask their physicians. So a typical day as a phlebotomist, basically our hours vary. You can come in early morning to do morning rounds on your inpatients, and you can come in later, a second shift. We take care of our inpatients first thing in the morning. That consists of basically you have a handheld and you take that out, and it has your labels that you would print out. You would ID your patient, you would scan that bracelet, print out your labels, and you get all your supplies ready to draw your patient in the morning. And then those get brought back to the lab and they get processed in a specimen processing area. Basically, we receive those specimens and then we distribute them to the department in the lab that they would go to, whether it's chemistry, hematology, blood bank, microbiology, wherever those specimens need, we distribute those. And then our outpatients, when that area opens up, we staff that, usually with 2 designated phlebots, and your job priority for that day is to take care of those outpatients. Those patients come to us with their outpatient orders, and we go into the computer, we order them if we need to, and then we collect them, and then our labels would print out and we draw the patients, and we ID those. We show the patients the specimens so they can make sure that their name and date of birth, everything matches. And then that is sent to the main lab, and we have 2 people that are in specimen processing. Those people, their responsibility is to double check the orders, receive the specimens, and then distribute those to the core lab or whichever department they need to go to. Up in specimen processing, those job duties also include going out onto the floor to ER, wherever needed for blood draws. Hours for a phlebotomist vary. There's days that we can come in and start our shifts at 4:30 in the morning. We have a 4:30, a 5, a 5:45, and an 8 o'clock shift for first shift. Our second shift phlebots, they come in about 2 and 1 at 3. We also work weekends. At this facility, we're able to work 1 every 4. So you're only working 1 weekend out of a month. Holidays, we have it to where we only work 1 holiday. There's enough of us here that we're able to have our weekends and our holidays set up that way. We also can work, depending on where you're scheduled or where you're trained at, we have off-site locations where you would work, and you're basically the only one at that off-site location. There you're trained to register patients and to draw your patients, and then send those specimens back to the main lab. In phlebotomy, we also do community outreach. We do occupational health health fairs. Those are typically during the weekends, or if they're during the week, somebody is scheduled to go there. And we go to different companies and we draw for their employees. And then we bring the specimens back, we order them and process them with our techs. For phlebotomy, you also need to look at if you're working at a bigger hospital, your job may only be drawing blood. You may be assigned to the floor, one of the floors, and that's your job for the whole day is drawing blood. However, with me working at the smaller hospital, my job duties extend into specimen processing and clerical work. But the bigger hospitals, you may only draw blood. You may be only stationed to work in an outpatient setting, or the floor setting. Another training that we've had here in phlebotomy and some of our techs that work second or third shift here, we have also been trained to do breath alcohol testing and drug screen collections. Those are mostly done through occupational health during the days. However, we are the coverage for when those office hours are closed.